Hi, I'm Dr. Monica Taylor-Desir, a community psychiatrist at Mayo Clinic, and I'm here to talk with you about post-traumatic stress disorder, or PTSD, what it is, what causes it, and how to manage it. Dealing with your own PTSD or helping a loved one can feel overwhelming. Understanding the basics is a good first step toward recovery. Post-traumatic stress disorder is a mental health condition that can happen after direct or indirect exposure to a traumatic event. Trauma includes things like a natural disaster or a pandemic, a serious accident, war, rape, sexual or domestic abuse, or a violent assault. You may have PTSD if you experience post-exposure symptoms for more than a month. Exposure includes direct experience, witnessing the event occur to others, learning that a loved one experienced trauma, or repeated exposure to traumatic events. PTSD symptoms may be persistent or triggered by something you see, hear, or experience. Symptoms fall into three categories: intrusive memories, such as recurring, distressing memories of the event, flashbacks, or nightmares; avoidance, such as not thinking about the event, avoiding situations that remind you of the trauma, or leaving situations because you feel anxious. Another category is changes in physical and emotional reactions, such as being easily startled or frightened, an increase in drug or alcohol abuse, having trouble sleeping or concentrating, becoming easily angered or having aggressive behavior, experiencing overwhelming guilt or shame, or having negative changes in thinking. PTSD is different from stress or trauma. It doesn't go away with time or self-care. It affects your ability to function and enjoy life. If you are experiencing PTSD, you are not alone. 6% of the population will experience PTSD. 12 million adults in the U.S. have PTSD annually. 8% of women will develop PTSD versus 4% of men. The good news is PTSD is treatable and recovery is possible. If you're uncomfortable talking openly to a loved one, that's okay. Look for online resources, a support group, or ask a healthcare provider for a PTSD assessment. Psychotherapy, peer support networks, coping techniques, medication, and complementary treatment like animal-assisted therapy and acupuncture can reduce symptoms. If you or someone you know is having difficulty coping with trauma, these interventions can make a huge difference. It's never too late to get treatment, no matter how long ago the trauma occurred. Coping with PTSD is a process that takes time. Be patient with yourself or those you are supporting through PTSD. Looking for more information about PTSD? Visit mayoclinic.org. We wish you well.